I am an interventional radiologist. There's a number of things I do. The main thing that I do has to do with basic radiology. I read x-rays, ultrasounds, MRIs, CTs, any type of imaging. The interventional part comes with procedures, biopsies. Someone has an abscess in their belly that the surgeon doesn't want to drain surgically. He may ask that I use CT to guide a catheter to drain the abscess. There are some other more specialized things that I do. Would you let me go into detail?
Sure.
Okay. We can pick, what I'll try to do is I'll just go over some different systems in the body and kind of tell you where I might fit into that beyond just the imaging part. If an older person has a lumbar compression fracture or a thoracic vertebral body compression fracture, what they may ask me to do is a kyphoplasty procedure. And what that involves is taking two fairly large needles, probably about a quarter the size of a pencil, and going through the muscles in the back, into the bones around the spinal cord, into the vertebral body, which supports your spine. Okay. The compressed fracture, if I can get a needle in them, I can place a large balloon, inflate the balloon, elevate the fracture, and fill it with methyl methacrylate or another bone-type cement. That hardens and prevents the fracture from getting any worse. And usually, in most patients, it reduces the pain by about 90%. And the reason that is, all the nerve endings are along the edge of the vertebral body. And when an older person or a young, usually this is reserved for older people, but occasionally for young people who might have cancer or something like that that might predispose them to a fracture, is that by stabilizing the fracture and keeping it from shifting and moving and being squishy, that allows the nerve endings to not be irritated as much, and usually helps to relieve the pain.